Did you know that according to the World Health Organization, over 80% of adults experience back pain at least once in their lives, and this number is even higher among older adults? As a specialist in senior healthcare, today I want to share with you the full picture of back pain, the real causes behind it, why each person experiences it differently, and, most importantly, which solutions are most effective for each individual. This is not just medical knowledge. It is proven methods and practical advice that you can apply immediately in daily life. If you care about your spine health and want practical exercise materials, hit the subscribe button and leave the word pain in the comments. I will send you a free 7-day exercise guide designed to relieve back pain safely at home. The human body is a living system where every organ has a unique role. The heart pumps blood, the lungs provide oxygen, the kidneys filter waste, and the spine acts as the central pillar that supports the entire body. When the spine is healthy, you can move with ease. But when it weakens, even the simplest activities become painful. Back pain is not just a symptom, it is a warning sign of deeper imbalances. There are many causes of back pain, and I will explain each one clearly, along with solutions tailored to every patient's condition. The first cause is age-related degeneration. After the age of 40, spinal discs begin to lose water, ligaments lose elasticity, and muscles weaken. Research at Harvard Medical School shows that almost 95% of people over 60 have some degree of spinal degeneration. Common signs include stiffness in the morning and needing 10 to 15 minutes of gentle movement before feeling better. For these patients, the solution is not complete rest, but consistent light activity, stretching, senior-friendly yoga, and daily walks of about 20 minutes, combined with calcium and vitamin D supplementation to slow down the process. The second cause is herniated or collapsed discs. This is when the soft inner material of the disc pushes out and presses on nerves. Johns Hopkins Medicine has shown that disc herniation is one of the most common causes of severe back pain in middle-aged adults. Patients describe the pain as sharp and nutrient supplementation. A 7-day starter plan that focuses on more leafy greens, small fish, low-fat dairy, morning sunlight, and simple core strengthening exercises like knee pulls, bridges, or modified planks can make a real difference. The fourth cause comes from working environments and daily habits. Office workers who sit for 8 hours a day with a hunched posture, or laborers who frequently lift heavy loads, both face a high risk of back pain. A Cleveland Clinic survey showed that more than 60% of office workers report back pain within 5 years on the job. For this group, the solution is ergonomic adjustment, keeping screens at eye level, using chairs with lumbar support, and standing up every 45 minutes. Learning to lift objects properly, bending at the knees instead of the waist, is also essential. The fifth cause is genetics and past injuries. Some people are born with discs that degenerate earlier, or spinal structures that are more vulnerable. Research at UCLA revealed that genetic factors account for about 30% of the risk of chronic back pain. Additionally, people with past trauma or spinal surgery often develop scar tissue that restricts normal movement and causes persistent pain. For this group, regular checkups, physical therapy, and close monitoring are key to long-term management. Another important cause is internal organs, especially the kidneys. Conditions like kidney stones or urinary infections often trigger back pain that does not change with posture and may come with fever or urinary changes. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, warns that these are red flags requiring immediate medical evaluation. So, what is the overall strategy for older adults with back pain? First, adjust lifestyle. Ensure good sleep and choose a mattress that is not too hard or too soft. Second, exercise gently every day to keep the core muscles strong. Third, maintain a balanced diet with enough nutrients. And finally, listen to your body. If red flag symptoms appear, seek medical help without delay. If you found this valuable, please subscribe to the channel, share it with your loved ones, and leave the word pain in the comments to receive the detailed guide. In the next part, I will show you the best sleeping positions and now let's take a closer look at what daily life changes really make the difference. Imagine two seniors, one who sits most of the day, eating quick meals, maybe skipping vegetables, and another who makes small adjustments, like standing every hour, choosing water over soda, and adding just 10 minutes of stretching before bed. Over months, the difference in their back health can be dramatic. Research from Harvard shows that people who maintain simple daily routines, like light walking and stretching, reduce their risk of recurring back pain by almost 30%. Let's talk about movement first. Many people think, my back hurts, I should rest. But actually, too much rest can make your back weaker. Gentle, consistent motion is the medicine here. Try this. Every morning, before you even leave your bedroom, pull one knee toward your chest and hold it for 5 breaths. Then switch to the other leg. It wakes up the lower back and sends a message to your brain that it's safe to move. Later in the day, a short 15-minute walk, even around the house or down the block, helps pump nutrients into your spinal discs. Think of it as oiling the hinges of a door. Without movement, those hinges stiffen and creak. Nutrition is the other side of the coin. Many older adults don't get enough protein because they eat smaller portions or avoid meat. But muscles that support the spine need protein to repair themselves. A simple target is to include a palm-sized portion of protein at every meal. It could be chicken, fish, beans, or tofu. And don't forget hydration. Dehydrated discs are more likely to shrink and press on nerves. Aiming for 6 to 8 glasses of water daily keeps your spine healthier than you might think. I also want to mention posture, because it is something we can all change right away. Picture how you sit when you watch TV. Do you slump into the couch, shoulders rounded forward? Over time, that position strains your lower back. A small pillow behind your lower spine while sitting can make a huge difference. And when you stand up, lead with your legs, not your back. These little adjustments, repeated day after day, add up to less pain and more freedom of movement. Resistance band, maybe a printed sheet of the exercises we talked about. When everything you need is in one place, it's easier to stick with the habit. Many of my older patients in the US have told me that this one simple step helped them turn good intentions into real daily practice. Finally, remember this: back pain is not your destiny. Even if you've lived with it for years, science shows improvement is possible with steady action. It's never too late to strengthen your body, improve your diet, and protect your spine. What matters most is consistency, doing small things every day rather than waiting for a miracle cure. So here's my challenge for you. Pick just one change from today's video. Maybe it's drinking more water. Maybe it's walking after lunch. Maybe it's adding a small stretch in the morning. Do it every day for the next week and notice how your back responds. When you're ready, add another. Over time, these layers of care build resilience, reduce pain, and give you back the freedom to live the way you want. If you're finding this guidance useful, don't forget to subscribe. Share this with a friend who also struggles with back pain, and type the word pain in the comments so I can send you the 7-day plan to get started. And remember, in the next video, we'll talk about the best sleeping positions and how to get out of bed correctly so you don't wake up with stiffness or pain in the morning. Stay tuned, because small changes today can lead to a much healthier tomorrow.